Well, good morning. We're here with Sami Pederson or Patterson from Oregon State University College of Veterinary Medicine, and is September 5th, 2012. So this is the sixth brigade, right? That we got organized here in the Ometepe Island in Nicaragua. It has grown tremendously from 6 students 6 years ago to almost 40 people.
Yeah, I think we have 29 vet students and 11 veterinarians and 1 technician with us this year.
Plus a couple of
significant others.
Right,
yeah.
significant others.
Husband, wife.
That was a word that I had to explain my wife.
Oh, really? Yeah.
Okay, so tell us, what does that mean for you guys, coming over here and serving the community with their pets, their livestock, their horses, their cats, their mules, and whatever they throw at you?
I mean, this is an incredible experience that the students at Oregon State are given, and it's just as much about teaching the students as it is, you know, us being able to provide something for the community. So this isn't something that we get this experience back at home. You know, it's something completely new, and the people who are bringing their animals here, like, they really need the services that we're able to provide too. You've seen some of the horses out there; they're really thin. They have a lot of parasites, and so we're able to help them and, you know, give them some better working and living conditions.
Same with the dogs.
Yeah, absolutely.
Some of those dogs, they really look bad.
Yeah, they're having, you know, multiple litters, and the puppies are just nursing on them, you know, constantly, and they can never really, like, regain their health status.
I don't know if you noticed, but the litters are very small.
Yeah.
2-3 puppies. Compared to Estrella. Remember last year Estrella with 11 or 12 puppies?
Yeah.
But that dog was fed well here at the hostel. So
yeah,
that makes,
she was healthy, you know, she didn't have as many parasites, she had, like, good muscling on her body, and she probably had a lot of time in between her litters to kind of, like, recuperate and gain some of her strength back.
One of the things that I think most people don't visualize is the fact that it's having a tremendous impact on public health.
Yeah.
The fact that we're lowering the population of dogs, and I recall 2 or 3 years ago that somebody did a small research on giardia on dogs, and I think it was 6%. And 6% means 40 to 50 dogs in the village carrying, defecating, and then passing that on to us.
Yep, which is a zoonotic disease. That's the term that we use.
What is it called?
Zoonotic.
Zoonotic.
Yeah, so it's when it's transmitted from animals to people or people to animals, and it's and you know, like, the living conditions here, you live very closely with the animals. You know, the dogs are around, and you are out working with the cattle and with the horses and the pigs. And I know we've been trying to do public health seminars the last couple of years. I know that we're doing one this year, and one of the years we talked about all those zoonotic diseases and how important it is to wash your hands before eating after you've been working with the animals, and just trying to increase awareness.
Don't walk barefooted, like the tourists come over here and they think they're in a carpet clean environment.
Yeah, exactly. Yeah.
And you see it here at the hostel with the chickens coming in and out, and the dogs and so on.
And it's kind of a fun idea, you know, to be well integrated with the animals, but you also have to keep the safety and health precautions, you know.
Do you think there are opportunities for other veterinary schools in the United States to get involved, or Canada?
Yeah, absolutely. So this is our 6th year coming, and Oregon State is pretty well known around the U.S. for our trip that we do down here. And we have been in communication with University of California at Davis, and they've started their own trip in Nicaragua, not at Ometepe, but I think they're out more on the western coast. And so they have a clinic that they're doing, and we're trying to help other, you know, veterinary schools start up their own programs and be able to come down.
The University of Georgia contacted me a few months ago, and then I passed on the information to you guys.
Yeah, excellent.
But at the bottom line is you need leadership, and I think this is what some of the other schools are lacking, is somebody to take just
take the reins and
run with it, and that's what's mostly lacking.
And you've seen it. I mean, coming, you know, like you've seen it firsthand through the years. You know those people from this group who kind of step up and, you know, take things on. And
then the other ones will learn. So
yeah.
it's not like you leave one behind. So,
right. Yeah.
So, you know, Kate and Julia and Sonja left you guys behind.
Yep.
And then now we have you guys.
And now we're ready to pass it on. We have a lot of great students this year who I was completely surprised by. You know, I was a little bit hesitant coming down and like couldn't be more pleased with the people who have stepped up and just taken charge and gotten things done, and they're like, I don't like the way this is working, let's change it, let's fix something. So
we also have, I noticed that there are 2 students that are not even in veterinary medicine yet.
Yeah, well, they're incoming, so they've been accepted into the program, and they're going to be starting when we get back in their first year.
So they're already getting all this experience before even they get into vet school. That's amazing.
Yeah.
Well, I can just thank all the people of Oregon that has made this brigade successful.
Yeah.
The community here really appreciate it. I mean, we're going to have a dance party. I understand you're going to a wedding. You're going back
I know.
today.
I have to leave early. I'm really disappointed.
So send us a picture. We'll follow you on Facebook or Twitter.
Okay.
And now we have a new Facebook page for the brigade.
Yeah.
And hopefully that
Laura's
will help.
Been really good at updating
that will help on the donations. You know, remember this is not cheap. Funding is very important. So all the folks out there in the United States, Canada, and Europe, please send in your donations. It's very important, right?
Yes, it is. It helps us buy the medications. It helps us, you know, like pay for the surgical instruments and everything to take care of the animals and
all the reusable stuff, the stuff that you leave behind.
Yep. Yeah.
And all the legwork that has to be done here in Nicaragua to make sure that the control medication is actually legal.
Exactly.
Sometimes it's a tightrope to get those
I know,
things,
it was a little bit tight this year. We'll
very
try
tight.
and get better at it.
I mean, I
next
have
year.
Mr. Nicaraguan just pointing at me and says, guys, you need to do this earlier.
I know.
But anyway, he realized, basically I told him, listen, there's 700 animals waiting for this brigade to come.
Yeah, for these
services. You don't give me the medication on time,
they're not going to get
it's
it.
It's going to be your fault.
I know.
And then I threw in that political side and then we had it the following day.
Yeah.
But normally we were actually late.
Yeah.
So
I think, you know, every year we're trying to improve some things. You know, we're trying to, you know, expedite processes. We're trying to have more things like prepared before we come down here. And like, you know, it's a learning curve, and it's really hard when you have such big turnover. You know, it's new people taking on each year. But
and not only that, but I think the universities are producing far better veterinarians because of this experiences. Not only from the skills that you get, but the human side. You know, the cultural experiences that you get, traveling overseas, learning some Spanish.
Yeah, mine's gotten progressively better.
I know you are. I mean, that's amazing. Your Spanish has improved dramatically. Okay, well, thank you very much for your help, and see you around, okay?
Yeah, thank you so much.
Good luck on your trip.
Thank you.